My name is Justin Kubeck. I'm an orthopedic spine surgeon, and I operate at Ocean Medical Center in Brick, New Jersey. The most important thing that people should know about back pain is it's very common. Most of the common attacks of back pain would be muscular strains. You bend to pick something up, strain a muscle, your back just sort of locks up. And that's pretty benign. That's the one that'll typically go away in a couple of days. If the pain persists, or if you start to get worrisome symptoms, let's say you start to get leg pain, or you had numbness going down your leg or weakness in the leg, if your leg doesn't work properly, if you started to have bowel or bladder dysfunction, which is a more serious, thankfully a very rare problem, those can be other specific problems that you need to get addressed. It's never a bad idea to get it assessed, even if you're having that acute attack of back pain and it's lasting past, let's say, a couple days. You take over-the-counter anti-inflammatories and the pain still isn't getting better, then it's a good idea just to get an appointment. If the pain persists past a couple days, couple weeks, you start to have leg complaints where you have numbness or pain or weakness, that's definitely something that you should see an orthopedic spine surgeon and at least get an assessment of what your particular problem is. Normally, treatment starts with a conservative approach. So different anti-inflammatory medications, if the patient can tolerate that. You have to be careful with different medications you're on because there can be some cross reactions or sensitivities. A short course of the pain pillar or muscle relaxer, especially for that first week of an attack, can be helpful. And then generally, I like to start either physical therapy or chiropractic care, depending on the patient, depending on what I think their problem is and what they'll best respond to. When someone gets to the point where they need surgery for back pain, there's a little bit of a bridge between what I would typically consider conservative care, the physical therapy, the medications, and then proceeding right to surgery. In some rare instances, someone would present where surgery is a sort of a first-line option, and that's when you would see someone like me, an orthopedic spine surgeon, to get an assessment of what your problem is and what the options are moving forward. My patients generally go home the day after surgery, so in general, it's a 23-hour stay. Everyone does recover at their own pace. But what I've seen, it's been pretty remarkable, and that's why my practice has shifted towards addressing a problem with a less invasive approach if possible.